Acid reflux, also known as gastroesophageal reflux disease or GERD, is a condition where the stomach acid and sometimes partially digested food flow back from the stomach into the esophagus. To understand how acid reflux works, it's important to know about the lower esophageal sphincter. The esophagus is the tube that carries food from the mouth to the stomach. The lower esophageal sphincter is a ring of muscle located at the bottom of the esophagus, where it connects to the stomach. Its primary function is to prevent the backflow of stomach acid and contents into the esophagus. In a healthy individual, the sphincter opens to allow food and liquid to pass into the stomach and then closes tightly to prevent acid and food from flowing back up. However, in people with acid reflux, the sphincter may weaken or relax inappropriately, allowing stomach acid to move up into the esophagus, leading to the development of complications like inflammation of the esophagus, narrowing of the esophagus, and in some cases esophageal cancer. Acid reflux can cause a range of symptoms that vary in severity and frequency. Common symptoms of acid reflux include acidic irritation. The stomach acid is highly acidic, and when it enters the esophagus, which is not equipped to handle the acid, it can cause irritation and inflammation. This leads to the characteristic symptoms of acid reflux, such as heartburn, a burning sensation in the chest. Regurgitation. Acid reflux can lead to a sour or bitter taste in the mouth, accompanied by the sensation of fluid or food coming back up into the throat or mouth. Chest pain. Some individuals may experience chest pain or discomfort that can be mistaken for a heart attack. This pain typically occurs after eating and may radiate to the neck, throat, or jaw. Difficulty swallowing. Acid reflux can cause narrowing of the esophagus due to inflammation or the formation of scar tissue. This can lead to difficulty swallowing or a feeling of food getting stuck in the throat. Chronic cough. Acid reflux can trigger a persistent cough that may worsen at night or upon waking up in the morning. This cough is often dry and does not produce much phlegm. Hoarseness or voice changes. Stomach acid irritating the throat and vocal cords can result in hoarseness, a raspy voice, or voice changes. Asthma symptoms. Acid reflux can worsen symptoms in individuals with asthma, leading to coughing, wheezing, or shortness of breath. Damage to the esophagus. Over time, the repeated exposure of the esophagus to stomach acid can cause damage. Several factors can contribute to the occurrence of acid reflux, including diet. Consuming certain trigger foods, such as fatty or fried foods, citrus fruits, spicy foods, chocolate, caffeine, and carbonated beverages, can relax the sphincter or stimulate excess stomach acid production. Obesity. Excess weight can put pressure on the stomach, causing the sphincter to weaken. Hiatal hernia. This occurs when a portion of the stomach pushes through the diaphragm, disrupting the normal functioning of the sphincter. Pregnancy. Hormonal changes and the pressure exerted by the growing uterus can contribute to acid reflux symptoms in pregnant individuals. Smoking. Tobacco smoke can irritate and weaken the sphincter. Certain medications and medical conditions. Some medications like certain pain relievers, sedatives, and medical conditions such as gastroparesis or delayed stomach emptying can increase the risk of acid reflux. Treatment for acid reflux typically involves lifestyle modifications, such as dietary changes, weight management, and avoiding triggers, as well as medications to reduce stomach acid production or strengthen the sphincter. Here are some tips for preventing and managing acid reflux with a healthy diet and lifestyle. Eat smaller meals. Consuming large meals can trigger acid reflux. Opt for smaller, more frequent meals throughout the day to reduce the pressure on your stomach. Avoid trigger foods. Certain foods can worsen acid reflux symptoms. Common triggers include fatty or fried foods, citrus fruits, spicy foods, chocolate, caffeine, and carbonated beverages. Keep a food diary to identify your personal triggers and limit their intake. Maintain a healthy weight. Excess weight can put pressure on your stomach, leading to acid reflux. Maintain a healthy weight through regular exercise and a balanced diet. Elevate your upper body while sleeping. Prop up the head of your bed by 4 to 6 inches or use a wedge pillow to keep your upper body elevated while sleeping. This helps prevent stomach acid from flowing back into the esophagus. Avoid eating before bedtime. Allow a gap of at least 2 to 3 hours between your last meal and bedtime to allow proper digestion. Stay upright after eating. Avoid lying down or bending over immediately after eating. Remaining upright helps prevent acid reflux symptoms. Reduce alcohol and tobacco intake. Both alcohol and tobacco can contribute to acid reflux symptoms. Limit or eliminate their use for better management. Manage stress. Stress can worsen acid reflux symptoms. Practice techniques such as deep breathing exercises, meditation, or engaging in activities you enjoy. Stay hydrated. Drink an adequate amount of water throughout the day. It helps maintain proper digestion and prevents dehydration. When it comes to managing acid reflux, incorporating certain foods into your diet can help alleviate symptoms. Here are some food choices that may be beneficial. Consume a high-fiber diet. Include plenty of fruits, vegetables, whole grains, and legumes in your diet. Fiber aids digestion and can help reduce acid reflux symptoms. Non-citrus fruits. Opt for non-acidic fruits such as bananas, apples, pears, melons, and berries. These fruits are less likely to trigger acid reflux symptoms. Vegetables. Most vegetables are well tolerated and provide essential nutrients. Green leafy vegetables, broccoli, asparagus, cauliflower, and cucumbers are generally safe choices. Whole grains. Incorporate whole grains like oatmeal, brown rice, whole wheat bread, and quinoa into your diet. These are rich in fiber and can help regulate digestion. Lean proteins. Choose lean sources of protein such as skinless poultry, fish, tofu, and beans. Avoid fatty cuts of meat and high-fat preparations that can worsen symptoms. Healthy fats. Opt for foods rich in healthy fats like avocados, olive oil, nuts, and seeds. These fats are less likely to trigger acid reflux compared to high-fat and fried foods. Low-fat dairy. If you tolerate dairy, opt for low-fat options such as skim milk, low-fat yogurt, and reduced-fat cheeses. However, if dairy triggers your symptoms, consider alternatives like almond or soy milk. Ginger. Ginger has natural anti-inflammatory properties and can help soothe the digestive system. Consider incorporating fresh ginger into your meals or drinking ginger tea. Non-mint herbal teas. Peppermint and spearmint can relax the sphincter and worsen symptoms. Instead, try chamomile, licorice, or marshmallow root tea, as these can be soothing to the digestive system. If you have watched this far, please consider dropping a like on this video and subscribing to our channel. Alkaline foods. Some alkaline-rich foods like almonds, spinach, kale, and cucumbers may help neutralize stomach acid. Including them in your diet may provide some relief. Remember, individual triggers can vary, so it's important to pay attention to your body's response and keep a food diary to identify any specific foods that may worsen your acid reflux symptoms. Additionally, portion control and eating slowly can also aid digestion and reduce the risk of reflux.